This month is Heart Month, and the Heart Foundation of Jamaica is placing emphasis on obesity as a major risk factor for heart disease. The theme for this month's observation is the way, that's WEIGH, to a healthy heart. Speaking at a recent Jamaica Information Service think tank, director at the Heart Foundation of Jamaica, Dr. Suzanne Suarez-Winter, said the situation has worsened over the last 2 years amid the global pandemic.
Many of us have had to change our eating patterns, our access to fruits and vegetables, and maybe healthier foods have been impacted just because of maybe just changes in our movement, loss of job. And then there's also the stress impact. So, with stress, many of us are at home, our whole lifestyle has been disrupted. So maybe we have adopted unhealthy lifestyle habits. Maybe we're not be able to quit smoking, maybe we're drinking more, we're less active and not moving around as much. And all of these things in some way, shape or form are major risk factors for both obesity and heart disease.
Dr. Suarez-Winter, who's also a clinical nutritionist at the Caribbean Institute for Health Research at the University of the West Indies, cited findings of a recent study conducted by the University of Technology.
80% of Jamaicans have actually gained weight over the pandemic, reported gain in weight, and 63% of them have changed their eating habits, and not necessarily for the better. And so because of this, it's also to recognize that prior to the pandemic, we were already having these major challenges. So prior to the pandemic, 1 in 2 adults were overweight, 1 in 3 children were overweight or living with obesity, and nearly 30% of the population already had hypertension.
She says the Heart Foundation has been seeing a large number of people who didn't realize they were hypertensive, and as such, she's urging Jamaicans to take the necessary steps to help protect themselves against heart disease.
One of the first things is really to probably just get screened. Get an idea of what your weight is. What is your body mass index, which is your weight divided by your height in meters squared. Get an idea of what your weight is, what is your blood pressure. Get measurements of your cholesterol, and these are measurements that we offer in our screening activities at the Heart Foundation of Jamaica. Another thing is really to become aware of just what you're eating.